something we call it DRG, or dorsal root ganglion. Okay, the ganglion is the compact of gray matter. Okay, it is outside of the spinal cord. The dendrites of the DRG goes to skin and receive the information. Okay, so the first order neuron in the ascending tract is DRG. The dendrite goes to skin and getting the information and come to DRG. Then the axon of the DRG comes to spinal cord. So the spinal cord is second order neuron. And after that, after the spinal cord, it goes to upward, to the brain. Okay? One part, we call it thalamus. Okay? You will study by another professor. Dr. Hassan Zadeh will come and tell you about the thalamus, about the cerebral cortex. So the third order neuron is thalamus. Okay? So from the first step, DRG, second step, spinal cord, and third step, thalamus. After the thalamus, the tract goes to a specific part in the brain. We have a specific part for specific things. For example, if the visual tracts that you want to see something, okay, comes to this part of the cortex of the brain, we call it occipital lobe. Or when you want to hear, it comes to this part. Okay, so we have specific parts in our brain, in our cerebral cortex, to analyze and process. It means that we have a specific part for a specific sense. Okay, it's not like that. For example, the visual part or visual information comes to this one or come to this one. The visual comes to back of your head, and the auditory pathway comes to temporal part. Do you remember in the head and neck I told you about the bones of the skull? Same as the bones, we divided the brain into several parts. For example, the brain is located in this part. We call it a skull. Okay? The brain located. The posterior part of the brain, we call it occipital lobe. The anterior parts of the brain, we call it frontal lobe. The lateral parts of the brain, we call it temporal lobe. Okay? Based on the bones, we divide the brain into several lobes. So the first order neuron is DRG. The second order neuron, I told you, is spinal cord, but in several tracts, it's not in spinal cord. It's another location. Okay? So you know about the first order neuron, second order neuron, and third order neuron. We study two specific tracts. We have lots of tracts, but I will tell you the important ones. Look at here. The pain and temperature pathway. It means that when something happens that you feel pain or something which is related to temperature, what happened that you understand? For example, you injure, or you, for example, feel you have a high temperature or a low temperature. Okay? So, and also you must know that we divide tracts into two types. We call it ipsilateral or contralateral. What does it mean? Look at here. I told you the first order neuron is DRG. By means of the dendrites, receive the information and comes to this part, DRG. Then comes to a spinal cord. If it comes to a spinal cord in this side, and then it goes to another side, then goes upward, we say contralateral. We call it contralateral. But if information comes to the spinal cord, look at here, it comes to the spinal cord and then goes upward in the same side. We say ipsilateral. It means that I am the information and comes by means of the DRG, I come to spinal cord. Okay? If I walk at this side, we say ipsilateral. For example, comes to the right side of the spinal cord and then goes upward in the right side of the, for example, brainstem, and goes to the right side of the cerebral cortex. We call it ipsilateral. But if I come to the spinal cord, then goes to another side and then goes upward to the brain, we say contralateral. Okay, so if you see this word, cross, cross means goes to another side. Okay, so pain and temperature pathway. The name of the tract is lateral spinothalamic. I told you, spinothalamic. It shows that it is ascending. It started from the spine and goes to thalamus. Okay, you will study what is the thalamus and where is the location of the thalamus. So we have lateral spinothalamic. You are seeing it comes to spinal cord, cross and go to another side, then goes upward to thalamus. Okay, I wrote it for you. Cross obliquely to the opposite side. Okay, and it goes upward until one nucleus of the thalamus. Okay, I don't want to focus on the thalamus because you will study and it gets our time. But look at here. This is the shape of thalamus. Okay, we divide the thalamus into several nucleus. Okay, we say VPL nucleus. Okay, one nucleus of the thalamus and you will study. The information from the spinal cord comes to this part, VPL nucleus of thalamus. What happened after this part? Goes to cerebral cortex. Okay, so it started from the outside and pain and temperature information comes to spinal cord, then goes upward, goes to VPL nucleus of thalamus, and after that goes to cerebral cortex. You are seeing, comes to this part, cross, and then goes upward to thalamus, and then go to cerebral cortex. So if I ask you at the exam, for example, the lateral spinothalamic tract goes to which part of the thalamus, you must say VPL nucleus of the thalamus. Or if I ask you, does this tract have as a cross or not? Because we have, I told you, because we have several tracts that they don't have any cross. It is comes to right side and then goes to right side. Okay, but this one has cross. And also maybe you see some word, we call it lemniscus. What does it mean? For example, she is one track, she is another track, and she is another track. Okay, they come and walk with himself. Okay, they make something that we call it lemniscus. It shows that lemniscus is made by several tracks. I am one track, another track, and another track. We start to go to some place. Okay, because they are coming together and because they are together, we call it lemniscus. Okay, the lemniscus, for example, you are seeing a spinothalamic anterior spinothalamic and lateral spinothalamic and spinotectal. Anterior spinothalamic, lateral spinothalamic, and spinotectal. They are coming together and made a spinal lemniscus. Understand? So this is the pain and temperature. You are seeing the picture. Another one, anterior spinothalamic tract. It carries information about light touch and pressure. What does it mean, light touch? We have two kinds of touch. Discriminative touch and light touch. For example, imagine that I have two needles, okay, and put in the skin. If I recognize these are two bonds, it means that it is discriminative touch. But if I put, for example, in some parts of the skin that doesn't have lots of receptor, and you just understand that this is the needle, you cannot understand this is two needle, three needle, or one needle. Okay? So we have light touch and discriminative touch. And also the anterior spinothalamic tract is related to light touch and pressure. It is same as before. Okay? Lateral spinothalamic and anterior spinothalamic are the same. Look at here, cross obliquely, accompanied by anterior spinothalamic and spinotectal made spinal lemniscus. And also it goes to VPL nucleus of the thalamus and then goes to cerebral cortex. So why we divided to anterior spinothalamic and lateral spinothalamic? Because when the information comes to the spinal cord, one of them is located anterior, another one located at lateral. Okay? Do you remember in previous session I bring the students here and I told you about the funiculus. I told you we have anterior funiculus, lateral funiculus, and posterior funiculus. Okay? So we have anterior spinothalamy and lateral spinothalamy. Because I told you the white matter of the spinal cord is related to the tract. Because the tracts are myelinated axon. Okay, so the anterior spinothalamic tract related to light, touch, and pressure. And look at here again, it's the same. Comes to spinal cord, goes to another side, goes to thalamus, goes to cerebral cortex. And again, VPL nucleus of thalamus. Okay, so if you understand about lateral spinothalamy, you understand anterior spinothalamy, just based on the location. After that, we have the sense of upper limb and lower limb. Do you remember about gracilis and conatus? I told you in previous session. The gracilis is related to lower limb and the conatus related to upper limb. I told you we have come here and you come here. And also you come here. Fast, fast, fast. Okay. Stay here. I told you we have posterior median sulcus. We have posterolateral sulcus. And also I told you, at the level of C1 to T6, we have another sulcus, posterior intermediate. So, by means of sheet, it divides the posterior funiculus into two parts. One of them is located here, gracilis. Another one is located here, conatus. The sense of the lower limb comes to this part, and the sense of the upper limb comes to this part, and then goes upward. Okay? Thank you, Sita. So you are seeing discriminative touch, vibratory sense, and conscious muscle joint sense. Sense of upper limb and lower limb. Fasciculus gracilis and fasciculus conatus. Look at here. The fasciculus gracilis. I told you about the DRG. Okay? The DRG, the dendrites of the DRG, getting the sense from upper limb and lower limb. It comes to spinal cord, but the second order neuron in the gracilis and conatus is not spinal cord. It comes to DRG, then comes to spinal cord, and then goes upward. Okay? Until where? Until this part. We call it medulla oblongata. Do you remember? I told you the upper parts of the spinal cord. I told you the spinal cord is started at the end of the brain, or from the foramen magnum. Okay, so we have something we call it brain stem. Okay, the lower parts of the brain stem is medulla oblongata. So the information, gracilis and conatus, both of them, comes to the spinal cord, then goes to gracilis and conatus tubercle at the medulla oblongata, and then goes to thalamus, goes to cerebral cortex. What is the differences between gracilis and conatus with anterior spinothalamic and lateral spinothalamic? No, both of them. Both of them goes to thalamus. Look at here, VPL nucleus of the thalamus, and then goes to cerebral cortex. The differences was the second order neuron. The second order neuron in the gracilis and conatus is located at medulla oblongata, and the first order and the second order neuron in anterior spinothalamic and lateral spinothalamic was located at spinal cord, and the DRG are the same in previous ones and here. So the information goes to medulla oblongata and goes to cerebral cortex, the sense of upper limb and lower limb. And you are seeing it comes to spinal cord, but it doesn't have any cross. Look at here, it comes to, for example, left side of the spinal cord and also goes upward in the left side. But in the medulla oblongata, it has cross and goes upward. Okay, so the previous ones, spinothalamic tracts, come to spinal cord, at the same side, goes upward to medulla oblongata, then it has cross and goes upward. So you are looking, ascend ipsilaterally, and I will tell you about internal arcuate fibers and sensory decausation, and it goes to VPL nucleus of thalamus. Okay? So this is the fasciculus gracilis, sense of lower limb. Again, you are seeing VPL nucleus of the thalamus, the information comes to the spinal cord, goes to medulla oblongata, cross and goes to thalamus and goes to cerebral cortex. We have several features that it is similar between the tracts. Okay, but for example, one difference in this tract is coming to medulla oblongata, and another one comes to the spinal cord and just go to thalamus. The next one, fasciculus conatus, completely the same as gracilis, but it carries the sense of upper limb. Okay, it comes to the spinal cord, ascends ipsilaterally, goes to medulla oblongata, then goes to VPL nucleus of thalamus, and then goes to cerebral cortex. You are seeing this one is gracilis, this one is conatus. Both of them goes to medulla oblongata. Then it has cross and goes thalamus, then goes to cerebral cortex. You have question? If you have question, ask. Okay. Again, another picture. I told you the four ones I tell you was related to the cerebral cortex. We have several tracts that doesn't need to go to cerebral cortex. They want to go to cerebellum. Okay? Posterior spinocerebellar tract, anterior spinocerebellar tract. What is the differences between them? One of them is located at the posterior part, another one is located at anterior part. And both of them started at the spinal cord, and both of them also goes to cerebellum. Okay? Posterior spinocerebellar. Look at here. This one, we have two tracts. Ventral or anterior spinocerebellar, and this one, the blue one, is dorsal spinocerebellar. What is the differences? Someone said, and get a plus. You must save the marks for the final marks if you want to pass. What is the differences between blue one and red one?
Dorsal receive the signals. Receive the signals.
Yes, both of them receive the signals. No, it's opposite. The blue one is dorsal and the red one is ventral or anterior. But what do you see? What do you understand from this one? Ventral is crossed, completely true. Okay, after the class, come and tell me your name. Look at here, the red one, ventral spinocerebellar. It comes to spinal cord. It has cross, then goes upward. But the blue one comes to spinal cord and goes upward at the same side. Okay? So one of them has cross and another one doesn't have any cross. Okay? So this one, the posterior spinocerebellar, here, you are looking. It receives the information of the trunk and lower limb. It doesn't important nucleus dorsalis. Same side. Look at here, same side. The blue one information come at the same side, goes upward and then goes to cerebellum. Okay? And also something like this. But the ventral comes to the spinal cord, has a cross, then goes upward. Okay? Understand? And you must, and I will tell you at the brain stem what is the peduncle. I will tell you about that. So posterior spinocerebellar. This one, anterior spinocerebellar, receive the information of the trunk and limbs, cross to opposite side. Look at here, comes to spinal cord, cross to another side, goes upward and then goes to cerebellum. This is the differences. The anterior spinocerebellar has a cross, but the posterior spinocerebellar doesn't have any cross. Well, we have another extra information. You are looking, I told you anterior spinocerebellar has a cross, okay? But I wrote it for you, cross back. What does it mean? It means that, look at me, I am the information, come to a spinal cord. And I am anterior spinocerebellar. So I must have a cross at the spinal cord. Okay? I came to another side. I goes to cerebellum. And also again I have a cross and goes to another side. So in this track we have two crosses. Okay? One of them at the spinal cord goes to cerebellum, another cross at the cerebellum. So it means that it is started from the right side, goes to left side, goes to cerebellum, and again come to right side. Something like this. Spinal cord, cross, go to cerebellum, again cross. So anterior spinocerebellar has two crosses. Posterior spinocerebellar doesn't have any cross. So if I ask you at the exam, which of this tract has two crosses, you must say anterior spinocerebellar. Understand? Spinotectal tract. This is sensory or motor? Why sensory? Yes, because of it is started from the spinal cord and then goes to one part. We call it tectum. Okay, maybe I will tell you, or maybe Dr. Hassanza will tell you. It's not important, but just you must know that spinotectal is related to vision. Okay, we have something we call it tectum in the midbrain, which is related to vision. Okay. I don't want to say lots of the tract and you will be confused. We have another one, spinal olivary, it doesn't important. And you are seeing here, look at here, this is a cross section of the spinal cord. Okay, it shows that, for example, look at here, I told you we have lateral spinothalamic and anterior spinothalamic. Look at here, they were the same. One of them is located into the lateral side, we call it lateral spinothalamic. Another one is located at the anterior side, we call it anterior spinothalamic. Okay? So this is just the differences between at the location of them and this. And also look at here, I told you about posterior spinocerebellar and anterior spinocerebellar. Okay, when you say something is anterior, it shows that we have something posterior. Okay, if we don't have, for example, we call it a spinotectal, just spinotectal, not lateral spinotectal or anterior spinotectal, just one. And you are seeing posterior spinocerebellar, anterior spinocerebellar. They were the ascending tract, sending the information. Okay, after the ascending tract, we have descending tract. Same as before, we have first order neuron, second order neuron, and third order neuron. Okay, these are motor comments or sensory comments. Motor comments. It shows that they were started from upside superior part, maybe for example cerebellum, maybe cerebral cortex, and then goes to spinal cord. Cortico-spinal tract. It started from where? Cortex. And terminate at spinal cord. You are seeing, it is started from the cerebral cortex. Okay? And it carries what? It carries motor comments or motor information. It started from the cerebral cortex, then comes to spinal cord. Do you remember? I told you about the cross-section of the spinal cord, okay? I told you the sensory information comes to DRG, then comes to gray matter of the spinal cord, then goes to brain. And at this time, you know that maybe it has cross, maybe doesn't have any cross. Maybe go to cerebral cortex, maybe go to cerebellum, okay? So this is the sensory information. After the sensory information, corticospinal tract started from the cortex and it is motor command. It comes to ventral part or anterior horn. And after that, it sends the rootlets to this part. I told you, before the intervertebral foramina, they are coming together. And make what? Make a spinal nerve. How many spinal nerve we have? 31 pairs. Okay? So the spinal nerve contains the sensory information and goes to brain. And the motor information comes to anterior horn. Then they are coming together and make spinal nerve. And then, if you remember, I told you it divides to two parts: dorsal ramus and ventral ramus. And also I told you the ventral ramus is thicker than. One of them goes to the muscles and skin of the back, and another one comes to anterior side and make plexus, cervical plexus, brachial plexus, lumbosacral plexus. Okay? So this is the pathway. Corticospinal tract. It is started from the cortex, come to medulla oblongata, and after that it comes to spinal cord and make rapid skilled movement. We have lots kinds of the movement. One of them is rapid. So the important one about the descending tract, about the motor commands, is corticospinal tract. It started from the cortex and terminate at the spinal cord and then goes to, for example, one muscle. And after that, you can move something, you can grab something, you can walk, you can use your muscles, okay, by means of this tract. Any question? And also you must know that if you have, for example, you remember in the sensory tract, I told you we have a spinotectal. In the reverse side, we have tectospinal. It means that I am one part of the spinal cord and send the information to her. She receives and gets to the brain and process and analyze, and then she gave me the tract. She gave me the motor information. The sensory information goes to somewhere, and that place sends the motor commands. I told about spinotectal, and here we have tectospinal. We have tectospinal and spinotectal. It means that it is started from the spinal cord and goes to tectum, and here they decide and send the motor from tectum to spinal cord. By means of the name, we can understand it started from somewhere in upper part or superior part and terminates at another part. And you are seeing it arises from one part because it's superior colliculus, and we say tectum. I will tell you in next session. It has a cross, because here we have the cross and we have the cross in ascending tract and also descending tract. You are seeing it is started from here. It has cross, go to another side, then goes to spinal cord. And also maybe we have, for example, another tract which is started here. It comes here and at the same side goes inferior. Ipsilateral tract, contralateral tract. Has a cross, doesn't have any cross. Okay? Maybe in ascending tract and maybe in descending tract. Do you remember in the previous session I asked you, the rubrospinal tract is ascending or descending? Okay? This is started from rubral. You don't know anything about the rubral part. Okay? But why? Rubrospinal. The rubro or red nucleus is located at the midbrain. Okay? It started at the midbrain and sent the information to the spinal cord. Which sends? Look at here. Facilitates the activity of flexor muscle and inhibits the activity of extensor muscle. It shows that this tract, which is started at red nucleus, you don't know about red nucleus. Okay, you will study and Dr. Hassanzadeh come and say to you about the red nucleus. But at this slide, you must know that it is started from somewhere. Red nucleus. Okay, it doesn't important. It started from the red nucleus and come to spinal cord. To do what? To do facilitating the flexor muscle. Okay, facilitating the flexion. If you want to flex one of your muscle, you must inhibit the extensor muscle. They are antagonists. They are in opposite side. Okay? So for example, you flex something by means of rubrospinal. Okay? Understand? Facilitating the flexor muscle and inhibits the activity of extensor muscle. If I ask you which tract is involved in, for example, facilitating the function of flexor muscle, you must say rubrospinal. It is started from one part, we call it red nucleus. It is located at midbrain and comes to spinal cord. Another tract, vestibulospinal. Did you remember what was the vestibular part? Vestibulocochlear. Did you remember? Which nerve? How many cranial nerves we have? 12 cranial nerves. The 8th one was vestibulocochlear. It's related to hearing and balance. Okay, it has two parts. It has two parts, vestibular part, and also we have another thing we call it cochlear. So the vestibular part, which is related to the balance, and also it is started from vestibular area and terminate at spinal cord. To do what? Facilitate the activity of extensor muscle. The previous one, rubrospinal flexion. But this one, vestibulospinal extension. Okay? So you understand that you have nervous system to monitor and control all parts of your body. Okay? For example, if you want to do a little things, a little flexion or extension, we have one tract. If you want to transform, for example, the sensory information, we have a specific tract for pain, for temperature, for light touch, for pressure, and also for the movement of muscle. Also, we have a specific tract, vestibulospinal, facilitating the extensor muscle, rubrospinal, facilitating the flexor muscle. And it is not important that you don't know about the vestibular part, okay? Because it is located at superior part. You will study. At this slide, you just want to know about the termination, about the function, and you must know that it is started somewhere in the superior part. And you are seeing it's related to hearing and balance. It is not important, olivospinal, and this slide is finished. After the spinal cord, we go to take a rest for 1 minute. class. Come back to class. Keep quiet. Keep quiet. I told you about the spinal cord, and you know about the external features of the spinal cord. I told you about the sulcus, about the fissures, about the tracts, about the gray matter, about the white matter. From this slide, we started to study brain stem. The brain stem, look at here. I told you the CNS includes brain and spinal cord. Okay. In the brain, we have something we call the cerebral hemisphere in right side and left side. And after that, we have something we call it brain stem. Okay, brain stem. And after that, we have spinal cord. Okay, so this is the CNS, central nervous system, brain and spinal cord. Spinal cord. And this is the brain stem. The brain stem is something like a bridge between the cerebral cortex and spinal cord. It includes three parts. From the upward, the superior part is midbrain, the middle part is pons, and the lower part is medulla oblongata. Look at here. This one is medulla oblongata. This one is pons, and this one is midbrain. The brain stem is something like a door. If you want to come to the class, okay, you must open the door and come. Okay? The brain stem is similar to the door. What does it mean? It means that when one tract wants to come to the brain, it must pass from the brain stem. And if one descending tract started at the cerebral cortex and it wants to go to spinal cord, it must pass from brain stem. It's something like an station. It's something like an station for coming the sensory information and goes upward, and also, yes, receiving or passing the descending tract from brain, cerebral cortex to come to spinal cord. So it's something like a station, and also it includes midbrain, pons, and medulla oblongata. Do you remember what was the importance of the anterolateral sulcus and posterolateral sulcus in the spinal cord? What was the importance? No, we have. I told you. I brought some student and told about the anterolateral sulcus, posterolateral sulcus. Why we have them? Yes, I know that. What is the importance? Why we have this sulcus? For passing what? That's true. For passing the sensory rootlet and motor rootlets. Okay? Same as before, we have, because I told you, when something is changing to another one, the speed of changing is low. For example, you know about the cervical column. In the cervical column, we have spina bifida, something like this, the spinous process of cervical part. If it wants to change to thoracic part, it's changed to one spinous process. So the C7 is similar to T1. Okay? When something is finishing and another thing is starting, they are a little similar to each other. And here, because at this part we have spinal cord, okay? Spinal cord. The shape of the medulla oblongata is similar to spinal cord. What does it mean? It means that at the medulla oblongata, again we have anterior median fissure, anterolateral sulcus, posterior median sulcus, and posterolateral sulcus. Okay, same as the spinal cord. But I told you in the spinal cord, they are important for passing the rootlets of and making or something spinal nerve. Okay, but in this part at the brain stem, why we have the sulcus? We don't have any spinal nerve. We are going to brain. Did you understand my question? Why we have the sulcus? We don't have any spinal nerve here. So why we have sulcus? No? No. No. The spinal cord is finished. We don't have any spinal cord. Look at here. The spinal cord finished and medulla oblongata started. But similar to the spinal cord, we have several sulcus at the medulla oblongata. Why? One of your friends said that about the passing the arteries and veins. If the arteries and veins don't pass from one sulcus, so what passes? Yes, the brain stem is something like a net or something like a station for passing something. But why we have this sulcus? Which message? Which nerve? Cranial nerve. I told you in the spinal cord we have a spinal nerve. And also I told you about the 12 cranial nerves. We have 31, we have 12 cranial nerves. Okay? So these sulcus are related to passing the cranial nerve. Okay? In the spinal cord, we have sulcus for passing spinal nerve, and in the medulla oblongata, we have sulcus for passing cranial nerve. Okay? We will study which cranial nerve pass from these parts. Look at here. Imagine that this is, I am the brain stem. I told you in the spinal cord, the sensory information pass from posterior or anterior. The sensory. Posterior. Okay? So, the sensory information started at the posterior part of the spinal cord and also pass from posterior to brainstem, similar to spinal cord. And the ascending tract in the spinal cord was related to anterior horn or posterior horn? Anterior horn. So the cerebral cortex sends the motor commands and it passes from anterior of the brainstem. The motor from anterior. Look at here. The descending fibers. The descending fibers pass from anterior to brainstem. And the ascending fibers pass from posterior to brainstem. Same as the spinal cord. In the spinal cord, we have sensory and motor. This is sensory in posterior. This is motor in anterior. So the motor part is the descending fibers, pass from anterior. And the ascending fibers pass from posterior to the brainstem. Okay? It was the reason that I told you the brainstem is something like a station, something like a door. Some tract pass from anterior of brainstem, another tract pass from posterior. The descending from, the ascending from posterior, the descending from anterior. The morphology. If you see at the book the name bulb, you must know that it is another name for medulla oblongata. Okay? Bulb is another name for medulla oblongata. It has 3 centimeter length. Okay? What is the shape of medulla oblongata? Look at here. It's something like this, being wide and continue. It shows that the superior part is broad, so the broad above, and it has 2 centimeter width at its upper end. So it is, for example, 2 centimeters, and the inferior part is, for example, 1 centimeter. Look at here. Look at here. It's something like this. It is started and then being wide. Okay? So the superior part of the medulla oblongata is wider, and it is 2 centimeter width. The inferior part is something like this. Okay? The superior part has 2 centimeter width. The inferior part is less. Another thing about the morphology, I told you, it is a junction, or it is a station between which part and which part? A spinal cord and pons. That's true. We have medulla oblongata. In the lower part we have spinal cord, and in the upper part we have pons. Okay? So this is about the morphology. Look at here. Which of them is the anterior view of the medulla oblongata, and which of them is posterior? This one is anterior. This one is posterior. How you understand this is anterior? From the how you understand? We have pons here, and also we have pons here. What? Intermedial fissure. Yes, you are seeing the word anterior and posterior. Imagine that this is not, this is hidden. Okay? You just see. Tell me, this is anterior or posterior? How you can understand? Look at here. If you look at the anterior view of the medulla oblongata, all parts of the medulla oblongata is closed. But if you look at the posterior view of the medulla oblongata, you are seeing an open part. Okay? Look at here. All parts is closed. But here, this is open. Why this is open? No. The spinal cord is finished. Look at here. This is brainstem, and this one is a spinal cord. The spinal cord doesn't continue to brainstem. Here, something like this. Brainstem, spinal cord. No. Passage is related to sulcus. Just sulcus. About, look at here, because of this one, we have the open part. What is this? Ventricles. Do you remember in the neuroganglial cells, in the introduction of nervous system, I told you we have one neuroganglial cells, we call it ependymal cells. I told you, imagine that in the brain, we have several spaces, something like this glass, okay? It's an space. It's covered by cells. Look at the wall. This is the ependymal cells, like a pool, okay? They are started to secrete. Secrete what? Cerebrospinal fluid, okay? So, this is the pool, and instead of water, we have cerebrospinal fluid, okay? So, we have 2 lateral ventricles. They secrete the cerebrospinal fluid. It comes to 3rd ventricle. Then comes to 4th ventricle. And after that, the cerebrospinal fluid comes to the spinal cord. This 4th ventricle is located between the cerebellum and medulla oblongata and pons. Come here. You come. But you are shy. Come here. She's brainstem. Go. Come here. Okay. She's brainstem. and I am the cerebellum. Okay? The cerebellum is located posterior to the brainstem. This space between us is fourth ventricle. Okay? So imagine that I am the cerebellum, she is the brainstem. Which part of the brainstem? Medulla oblongata and pons, not midbrain. The midbrain, for example, the midbrain is located here. The midbrain doesn't relate to fourth ventricle. Just, for example, pons and medulla oblongata in the anterior part, and also I am the cerebellum in the posterior part. The space between us, thank you. The space between us is fourth ventricle. You are seeing cerebellum in the posterior, me, and the pons and medulla oblongata, she. Okay, anterior and posterior, and space we call it fourth ventricle. So why this part is open? Because here we have medulla oblongata, here we have pons, and then the cerebellum comes and make the fourth ventricle between them. Okay, so it must be open because it is an space. Okay, in the anterior we have pons and medulla oblongata, and then the cerebellum comes, and this part and this space is fourth ventricle. Full of what? Full of CSF, cerebrospinal fluid. So if you look at the medulla oblongata, it has closed part and open part. Closed part and open part. We have closed part in the anterior view, and also we have closed part and open part in posterior view. So you understand that. You understand that. You understand that we have closed part in medulla oblongata in the posterior view, and also open part, both of them, open and closed. But in the anterior view, we just have closed part. Understand? Question? If you have question, ask. Don't be shy. Okay? So we have closed part and open part. The open part is located into the posterior view and related to fourth ventricle. So if I ask you why we have the why, for example, we have open part in the posterior view of the medulla oblongata, you must say that it wants to make the fourth ventricle. I told you about the ventricle and this part. It is repeated. I told you in the spinal cord we have anterior median fissure, posterior median sulcus, anterolateral sulcus, and posterolateral sulcus. I told you anterior median fissure for artery, anterolateral for motor rootlets, posterolateral for sensory rootlet, and the posterior median sulcus for veins. Okay, and also I told you each of them has a vein. What about what about the medulla oblongata? Anterior median fissure and posterior median sulcus is the same of spinal cord. What about the anterolateral and posterolateral? I told you the sulcus of the medulla oblongata is related to passing cranial nerve. Which cranial nerve? From the anterolateral sulcus, hypoglossal nerve. Which number? For the muscles of the tongue. The number 12. The number 12 is related to hypoglossal nerve. Posterolateral, passing the rootlets of glossopharyngeal, vagus, and accessory. Which number?
9, 10, 11.
9, 10, 11. 9, 10, and 11. Okay, so the anterolateral for passing hypoglossal, the posterolateral from superior to inferior, 9, 10, 11. Look at here. Look at here. This part. This is anterior median sulcus. This one is anterolateral sulcus. Which nerve passes? Hypoglossal nerve. Because we have 12 cranial nerves emerge from the brain and pass from one foramen and comes to a specific part. I told you the muscles of the tongue related to number 12. Or for example, the muscles of the face is related to number 7. The accessory and trapezius related to number 11, accessory. Vestibulocochlear related to hearing and balance, related to number 8. So we have hypoglossal nerve. After the hypoglossal nerve, we have look at here. This one is anterolateral. And posterior to that, we have posterolateral. For which nerve? Hypoglossopharyngeal nerve. This one is accessory nerve. And the middle of them, we have vagus nerve. Number 9, number 10, and number 11. Okay? So, anterolateral for number 12. Posterolateral for number 9, number 10, and number 11. These are the sulcus that we have in medulla oblongata. If you look at the anterior surface, okay, if you look at the anterior surface, I told you we have anterior median fissure. Okay, anterior median fissure. After that, we have anterolateral sulcus. Come, I use you as a mulach. Come here. I am the anterior median fissure, and she is anterolateral sulcus. I told you in the spinal cord between us was which funiculus? Anterior funiculus. Okay, but in the medulla oblongata we have something, we call it pyramid. What is the pyramid? The pyramid are all of the fibers which is started at the cerebral cortex and wants to go to a spinal cord. So it means that it is sensory or motor. Start at the cortex, go to a spinal cord, motor. Look at here, caused by a large bundle of fibers that descend from the cerebral cortex to spinal cord. And also I told you, the anterior view, the anterior part of the brain stem is related to motor part. If I turn the medulla oblongata from the posterior, you will see that it relates to sensory information. So, in the anterior surface, we have anterior median sulcus, pyramid, and anterolateral sulcus. The anterolateral for passing number 12. You are seeing anterior median fissure. This one is anterolateral and anterolateral, and between them these are pyramid. Okay, understand? Question? Why you are silent? It's hard.
Yes.
Try to understand. It doesn't relate to me. So you are seeing. It's similar to a spinal cord, just here and a little analyze. Use your cerebral cortex. Okay? We have anterior median fissure, anterolateral sulcus. Between them we have pyramid. The pyramid are descending fibers. It shows that all the fibers, all the motor commands comes to the green color, comes to pyramids. Okay? This is the anterior view of medulla oblongata. In the lateral surface, it's completely clear that in the lateral surface we have anterolateral sulcus and posterolateral sulcus. Okay, this is the lateral view. Another one, come here. Why you sit in the first row? Are you come here? At this slide, I want to say about the lateral surface. It shows that between anterolateral and posterolateral, and I'm looking from this side, okay, lateral view. So in the lateral view, we have anterolateral, posterolateral, and between them, we have something, we call it olive. For example, I am standing here, you are seeing anterolateral sulcus, posterolateral sulcus, and my hand is something, we call it olive. Thank you, sir. We call it olive. Look at here, anterolateral for passing number 12, posterolateral number 9, number 10, and number 11. Between them, we have something, we call it olive. I told you, or maybe another professor told you, in the anatomy, in our body, we don't have lots of space. Okay? We are limited. For example, we have a specific space. So we have lungs, we have heart, we have liver, we have kidney, okay? We have limited space. So they affect each other. Okay? Because they are very close. At this class, you have a big class, and for example, you are sitting here, another one is sitting there. But imagine that we have, for example, 50 students just at this space. Okay? So you are very close to each other and make effect to another person. We have it, for example, if you turn the line, you will see a depression for the cardia or for the heart. Or if you, for example, look at the liver, you will see the effects of the kidney. Here, in several parts of the brain, we have something like this. Here we have olive. It is an eminence. Why it is happening? Because we have a nucleus. For example, I'm standing here and look at my, get here. For example, I have a nucleus here. It causes that you are seeing my shirt something like this. Okay? But in another part, you are not seeing. So, this is an eminence caused by one thing. Here, we have olive. It is produced by a large fiber of gray matter called inferior olivary nucleus. It shows that, for example, it's something like this. If I put my hand and look at here, okay, you are seeing that the effects of my finger. We have one nucleus, we call it inferior olivary nucleus, and by means of this nucleus, we have an eminence. We call it olive. If this eminence caused by vagus nerve, we call it vagal triangle. If it is caused by hypoglossal nucleus, we call it hypoglossal triangle. And in this part, because it is made by the inferior olivary nucleus, we call it olive. Okay? For example, the girls have earrings. Okay? Because of this earring, for example, when I'm looking at you, I see that, for example, the scarf is a little eminence. Okay? If another person doesn't have any earrings, for example, this is smooth. Okay? So, in the lateral part, we have olive here. And also you can see the olive in the anterior view, but a little. Look at here. I told you anterior median fissure, pyramid, anterolateral, and also here we have olive. But if you want to see the olive better, you must look at the lateral view. It can be seen in the anterior, and also more can be seen in lateral surface. The posterior surface, I told you, the posterior surface is having closed part and open part. The open part is related to cerebellum. To make what? To make fourth ventricle. And look at here. Look at here. We have closed part and open part. The open part for relation to the cerebellum and make fourth ventricle. The closed part has another function that I will tell you. So this is the posterior surface. You want to take a break? Yes? Okay, take a break for 5 minutes, then we continue. At mediate sulcus. I told you at C1 to T6. If we have posterior median, posterolateral, I told you we have two extra sulcus, posterior intermediate. And also I told you it divides the posterior funiculus into gracilis and conatus. Gracilis and conatus. Upper limb, lower limb. Lower limb and upper limb. Okay? They get the sensory information from upper limb and lower limb. If we come to the medulla oblongata and look at the posterior view, we can see again this part is posterior intermediate. Okay? We have the posterior intermediate again in medulla oblongata. Because of what? Because we have two tubercles, geracil tubercle and connate tubercle. Why we have them? Because the information, the sensory information of upper limb and lower limb come to the spinal cord. After the spinal cord, do you remember in the tract I told you about fasciculus gracilis and fasciculus conatus? The information comes to the spinal cord, then goes upward. I told you it comes to medulla oblongata. So the gracil, the fasciculus gracilis, comes to geracil tubercle here, and the conatus coming to this part, connate tubercle. Okay, this is the second order neuron of gracilis and conatus. The sensory information comes to spinal cord, then goes upward until which part? The gracilis comes to medial one, and the conatus comes to this part. So we can see gracil tubercle, connate tubercle, and posterior intermediate. You are seeing here posterior median sulcus, posterolateral sulcus, and posterior intermediate divides to medial and lateral. The lateral connate tubercle related to fasciculus conatus. The gracil medial and related to fasciculus gracilis. So it shows that the sensory information, when you touch something by your hand, the information comes to the spinal cord, then goes superior to which part? Connate tubercle, the upper limb. And the sense of the lower limb comes to the spinal cord, goes superior to where? To gracil tubercle. Okay? These are two connates that we have in medulla oblongata. Another picture, again, geracil tubercle, connate tubercle, posterior median, posterior intermediate, posterolateral, it's the same. And this part is posterior view or anterior view? Posterior. Why? That's true. If you are seeing this part is open, you can easily understand that this is the posterior view. Okay? It is open, and the pons came, and the medulla oblongata came, and the cerebellum from the posterior view came, and this part is which ventricle? Fourth ventricle. The fourth ventricle is related to this part, the open part of pons and medulla oblongata and cerebellum. I told you the upper part of the posterior part is related to the fourth ventricle. Okay, the fourth ventricle. Look at here. What we can see, we have posterior median, same as before, same as the callous part and same as the spinal cord. Median sulcus, which is located at posterior. Look at here, at this part, this part, the open part of the medulla oblongata. Okay, the open part of the medulla oblongata, and this part is the open part of the pons. Okay, they are coming together and make something in this part, in this shape. Okay, the upper part related to pons, the lower part related to medulla oblongata. What we can see here, I told you we have median sulcus. Another thing that we can see here and here, we have two triangles. Do you remember I told you we have olive in the lateral view of the medulla oblongata. Why we have the olive? It was caused by the inferior olivary nucleus. Okay, I show to you this one, and I put the pressure, and you are seeing the effect of my hands. Here we have olive, the effect of inferior olivary nucleus, and here we have this one, the upper one. We have hypoglossal triangle, and the lower part we have vagal triangle. Why we have them? Because of what we have vagal triangle and hypoglossal triangle. No. I told you the effect of nucleus is made olive. Here we have the effect of vagal nucleus. So we have vagal triangle, the number 10. We have hypoglossal nucleus. We have hypoglossal nerve, the number 12. So we have the related nucleus. It shows himself, or it shows the eminences is like this. For example, in the upper part we have hypoglossal nucleus. In the lower part we have vagal nucleus. They put pressure, make an eminence, and we can see by means of these triangle, vagal triangle and hypoglossal triangle. At the junction, this is closed part of medulla oblongata, this is open part. At the junction of this open part to closed part, here and here, we have two areas. We call it area postrema. The area postrema is a location for controlling the vomiting process. Okay? The vomiting process is related to these two parts. Area postrema. If I ask you, the area postrema is related to balance, hearing, vomiting, or something else. You must say that vomiting process, controlling the vomiting process. Area postrema. What is apex? What is apex? When the open part of the medulla oblongata reach to closed part, we say this part as apex. If I ask you, what is the apex? You must say that at the junction of open part to closed part. For example, this is the open part, this is the closed part, they are coming together, and this part is apex. And near to the apex, we have area postrema for controlling the vomiting process. You are seeing another picture. Open part, closed part. Geracil tubercle, connect tubercle, this one is apex. at the junction of open part and closed part. Here we have area postrema for vomiting process. I told you we have two triangles, hypoglossal triangle and vagal triangle. The nucleus of number 10 and the nucleus of number 12. Okay? These are all the features that we can see in anterior view and posterior view of medulla oblongata. These are just the things that we can see in external view. For example, I told you, I'm looking at you and I'm seeing what? I'm seeing the glass, I'm seeing the scar, I'm seeing the eyes, I'm seeing the, for example, leaves. Okay? These are the features that we can see in medulla oblongata. Open part, closed part, anterior fissure, anterolateral fissure, posterior median, posterolateral. These are the external view. If we want to see the internal features, what we should do? If I want to see your liver, your heart, your lung, what should I do? A cut, or a section, or CT scan, or MRI, okay? At this part, if we want to see the internal features of medulla oblongata, we must have section and section. But it is important to choose the best location for section. We choose this one. Look at here. Which of them is anterior and which of them is posterior? The left one is posterior because of the open part. And the right side is closed because all the parts is open. All the parts is closed. So this part I told you we called it brain stem. Okay? Brain stem includes midbrain, pons, and medulla oblongata. We choose 3 levels for medulla oblongata, for seeing something, for seeing the internal structure. The number A, part B, and part C. Okay? All of them have the specific name. Why they have a specific name? Look at here. The first one, the number A. We called it transverse section at the level of pyramidal decussation. What was the pyramid in the anterior view of medulla oblongata? No, what was the pyramid? I told you here, look at here, this one is pyramid. What is the pyramid? I told you, the cortical or the descending tract, which is started at the cerebral cortex and wants to go to a spinal cord. Okay? All of the tracts coming together and make these pyramid. Okay? So we have the section at the pyramid, or we call it pyramidal decussation. What does it mean? Decussation. What does it mean, decussation? Look at here. We call this part pyramidal decussation. What do you think? What do you understand from the picture? Say. That's true. What is this? Okay, say it Arabic. Taqatu. Taqatu. In Persian we call it taqatu, and also in Arabic. We call it pyramidal decussation, or in Arabic you say haram. Haram. Okay. Pyramid means haram. Ahram salase in Egypt. Okay. This one, these are pyramid or haram. At this part, pyramidal decussation, or we call it taqatu' harami. Taqatu' harami, نقطه تقاطع harami. Why we say pyramidal decussation? I told you the pyramid or the haram is the descending fibers. Started from cortex and wants to reach to spinal cord. Okay? These are the tracts coming. These are the motor parts. They are coming at the pyramid. Okay? They are coming at the pyramid. 80 to 85 of the tract has a cross at the medulla oblongata, at the pyramid. 80 to 85% has a cross in the medulla oblongata at the pyramid level. And also 10 to 50 doesn't have cross in the medulla oblongata. But you must know that all the descending fibers, all the motor comments, which is started at the cerebral cortex and wants to go to the spinal cord, must have cross. But I wrote it for you. 80 to 85% have a cross in pyramid. What about this part? 10 to 50. They have cross at the spinal cord. Okay? So it shows that it is started from the cerebral cortex and come to medulla oblongata. 80 to 85% has cross at medulla oblongata. But 10 to 50 continue at this part until spinal cord. Here we have the spinal cord. It comes to the spinal cord, then it has cross and go to another side. Okay? So, all the descending tract from cerebral cortex has cross. 80 to 85% has a cross at medulla oblongata, at the pyramid. And 10 to 50 has the cross at the spinal cord. Okay? So this is the pyramidal decausation, and we have this cross. Another thing that we can see, look at here. This one is posterior or anterior? This one? Why posterior?
Because the pyramid is on the anterior part.
What?
The pyramid
Okay?
is located in the anterior part.
Completely true. The pyramid is located anterior, so this part is posterior. And also, I told you, in the posterior part of the medulla oblongata, we must see what? We must see gracilis and conatus. The medial one, gracilis, and the lateral one, conatus. Gracilis, conatus. Okay? We can see gracilis and conatus. I wrote it for you. Fasciculus gracilis, fasciculus conatus. Okay? We can see the causation of the pyramid. And also we can see a spinal nucleus of trigeminal and reticular formation. Okay? The reticular formation you will study at the next sessions. But at this time I will tell you a little about that. The reticular formation is something like a net. Okay? It is located at all parts of the brain stem. Midbrain, pons, and medulla oblongata. It's something like a column. The function of reticular information is awareness. So, if the reticular formation is danger or is injured, what happened to the body? For example, she is responsible for awareness of the class. Okay? If I kill her, what happened? The awareness of the class or the awareness of the nervous system being damaged. What happened to the body? Did you hear anything about coma? Okay? The coma is the lack of awareness. He or she asleep at the hospital. Okay? They don't have any awareness. So if the reticular formation, which is located here, is damaged, coma is happened. So the reticular formation is responsible for awareness. You are seeing reticular formation. What about the trigeminal nerve, number 5? Okay, the trigeminal nerve is the number 5 of the cranial nerve. I told you, which cranial nerve is the longest? Vagus. Why it is long? Because it emerges from the brain, it passes from the thorax, goes to abdomen, and make the parasympathetic innervation of the abdomen and thorax. Okay, this is the longest. The vagus is longest nerve. But we have trigeminal nerve. The trigeminal nerve, look at here, you will see in the next slide. For example, we have hypoglossal nerve just at medulla oblongata. But we have trigeminal nerve in all parts of the brain stem. Midbrain, pons, medulla oblongata. Something like this. We called it trigeminal nucleus. The trigeminal nucleus occupies midbrain, pons, medulla oblongata, and also a little of spinal cord. So at this view, you can see gracilis, conatus, spinal nucleus of the trigeminal, reticular formation, pyramidal decussation or Babak Ebrahimi, and something like this, just this. This is the structure that we can see. For example, imagine that you want to see, for example, the section of my abdomen. Okay? If you have a section from this part, could you see the heart? Could you see, for example, the brain? If you want to see my heart, you must have a cross section at this part. But if you have a cross at this part, could you see the liver, the kidney, the bladder? Okay? So, based on the levels that you choose, you can see different things. At this part, you can see these ones, at the pyramidal decussation. And you understand why we have pyramidal decussation. 80 to 85 of tracts, which is started at the cerebral cortex and wants to go to spinal cord. This is another picture from another book. Again, gracilis, conatus, spinal nucleus of trigeminal, and here we have pyramidal decussation. The next one, the number A is finished. What about B? We say the B is sensory decussation. What do you think about that? What does it mean, sensory decussation? In Arabic, what do you say to sense? His. His? Ihsas. His. Here we have sensory decussation. It means تقاطع حسی, تقاطع احساس. Okay? What does it mean? Which sense has crossed here? No. I told you about gracilis and conatus, the sense of upper limb and lower limb. Look at here. At this level, we have gracilis nucleus and conatus nucleus. The information from spinal cord, the information from the spinal cord comes to this part, gracilis and conatus. Okay, the sense of upper limb and lower limb comes to this nucleus. What happened after that? After these two nucleus, we have two fibers. We call it internal arcuate fibers. The internal arcuate fiber arises from gracilis and conatus, and they have keras. Go to another side, and then goes to thalamus. Okay? So, the previous one was motor decussation or pyramidal decussation. This one is sensory decussation. Internal arcuate fiber arises from gracilis and conatus, and they have keras. Go to another side, and then goes to thalamus. Okay? So the previous one was motor decausation or pyramidal decausation. This one is sensory decausation. The sense of upper limb and lower limb comes to gracilis and conatus. Then we have internal arcuate fibers. Then we have sensory decausation. Then it goes upward. Do you remember I told you about the lemniscus? I told you, for example, two tracts coming together and what? Here we have medial lemniscus. The medial lemniscus is gracilis tract and conatus tract coming together make internal arcuate fibers. And after this level, by the name of medial lemniscus, goes to thalamus. And after the thalamus goes to cerebral cortex. You are seeing gracilis and conatus, which is located here. They made internal arcuate fibers, made medial lemniscus. We have sensory decausation. This one is not important for you, and also this one is not important for you. Okay, so the important things at the sensory decausation is the decausation or taqatu for ihsas. Ihsas upper limb, the sense of upper limb, and the sense of lower limb. Okay, you can see it. And the last thing I will tell, and you can go. We have several nucleus here. Hypoglossal. What do you think? From this nucleus, this one is hypoglossal. Hypoglossal and hypoglossal. After that, we have another nucleus, dorsal vagal. After that, we have another nucleus, solitarius. These are three nucleus, three important nucleus. The hypoglossal for making number 12. The dorsal vagal for making number 10, vagus nerve. The solitary tract relates to taste. Related to the taste. The ambiguous, we called it vocal and swallow. It shows that every cranial nerve which is involved in speaking and swallowing, and the rest of them is not important. So you are seeing hypoglossal, dorsal vagal, solitarius, and this one is ambiguous. These four are important. We will discuss at the next session. You can go, and